He spilled his coffee on the floor and snapped, "Clean it up," treating the quiet black nurse like she was invisible trash, never suspecting that the woman on her knees was actually a world-renowned cardiothoracic surgeon, and in less than an hour, she would be the only person in the room capable of saving his dying patient. Welcome back to another powerful episode of Black Lives Story. Today, we are taking you into the high-pressure world of the operating room, where one mistake can cost a life. In this story, we meet Aisha Reynolds, a brilliant surgeon forced to work as a scrub nurse to survive. She stays silent while an arrogant chief surgeon takes all the credit, until a catastrophic error forces her to break every rule in the book to save a child. If you believe that true talent cannot be hidden by a title or a uniform, please hit that like button and subscribe to our channel right now. Share this video with someone who needs to be reminded of their own worth today. Now, let's scrub in and see what happens when the help takes over the surgery.
Dr. Gregory Brock didn't walk through the corridors of St. Jude's Research Hospital. He patrolled them. He was the chief of cardiothoracic surgery, a title he wore like a crown. At 50, he was silver-haired, tanned from weekends in the Hamptons, and possessed the kind of teeth that looked expensive. "Our mortality rate is 0.04%, Brock announced, his voice booming for the benefit of the 5 board members trailing him like ducklings. He gestured to the Wall of Fame. "That is half the national average. When people come to St. Jude's, they aren't paying for health care. They are paying for certainty." He stopped in front of a bronze plaque. It read, "The Brock Wing." He adjusted his silk tie, catching his reflection in the polished metal. He smiled at himself. "Impressive, Gregory," the chairman of the board said, nodding. "And the VIP patient today? The senator's daughter? A routine atrial septal defect repair." Brock dismissed it with a wave of his hand, holding a steaming cup of artisan espresso in the other. "I could do it with my eyes closed. In fact, I might just to make it interesting." The board chuckled. They loved his arrogance. It smelled like profit. Brock turned to lead them toward the surgical suites. As he spun, his elbow clipped the edge of a passing gurney. Splash! The dark, scalding espresso erupted from the cup. It splattered across the pristine white linoleum floor and speckled the cuffs of his Italian trousers. "Damn it!" Brock shouted, the charm evaporating instantly. The hallway went silent. Nurses froze. Brock looked down at the brown puddle spreading on his floor. It was a blemish. It was imperfection. He looked around for someone to blame. 10 feet away, a woman was on her knees. She was wearing standard-issue blue scrubs, but they were oversized, hiding her figure. Her hair was tucked completely under a scrub cap. She was scrubbing a scuff mark on the baseboard with a sponge, a task usually reserved for housekeeping, but the hospital was short-staffed, and she was the kind of employee who did what needed to be done. This was Aisha Reynolds. "You," Brock snapped, pointing a finger at her. Aisha looked up. Her eyes were dark, deep, and intelligent, framed by lashes she didn't bother to curl. She saw the coffee. She saw the rage in the chief's eyes. "Dr. Brock," she said, her voice soft, carrying a lilt of a Nigerian accent she tried hard to flatten. "Look at this mess," Brock gestured to the coffee. "Clean it up. Immediately. Before a patient slips." I am prepping the kits for the ICU, doctor," Aisha said gently, holding up the sponge she had been using for the wall. "Environmental services is on the way." "I don't care who is on the way," Brock stepped closer, looming over her. "I am telling you to do it. You're wearing scrubs, aren't you? That means you work for me. And right now, your job is to make my floor look like I didn't just spill a $6 latte on it." The board members watched, uncomfortable but silent. Aisha looked at the puddle. She looked at the man. In her head, she wasn't a scrub nurse. She was Dr. Aisha Reynolds, top of her class at the University of Lagos, a woman who had performed open-heart surgery during a generator failure with a flashlight in her teeth. She knew more about the vascular system than Brock likely ever would. But here, in America, her degree was paper. Here, she was just the help. If she argued, she would be labeled difficult. If she refused, she would be fired. And she needed the visa. She needed the money for her sister back home. Aisha swallowed her pride. It tasted like ash. "Yes, doctor," she whispered. She crawled over to the puddle. She used her sponge to soak up the coffee at his feet. Brock didn't move. He let her clean around his shoes. "Good," Brock sneered, turning back to the board, his smile returning as if a switch had been flipped. "As I was saying, excellence is in the details." He walked away, leaving wet footprints and a woman on her knees. 1 hour later. The women's locker room smelled of stale deodorant and fatigue. Aisha sat on a narrow wooden bench, tucked in the furthest corner, hidden by a row of gray metal lockers. She wasn't looking at her phone. She was holding a thick, glossy magazine, the Journal of Thoracic and Cardiovascular Surgery. It was the latest issue. She had spent her lunch money to buy it. Her finger traced the text of an article titled, "Anomalous Arterial Structures in Pediatric Patients." She frowned. She pulled a red pen from her pocket. "The path of the retroesophageal artery is typically linear," the text read. Aisha uncapped the pen. She crossed out linear. In the margin, in neat, precise handwriting, she wrote, "Incorrect. In 12% of sub-Saharan phenotypes, the curvature is helical. See case study 402. She was debating with the author in the margins, her mind alive, firing on all cylinders. This was the only time she felt real. When she read the medicine, she wasn't a cleaner. She was a surgeon again. The locker room door banged open. Aisha gasped. She slammed the journal shut and shoved it under her pile of street clothes. She grabbed a romance novel she kept as a decoy and opened it, hunching her shoulders. 2 other nurses walked in, laughing. "Did you hear him?" one asked. "Brock is on a warpath today." "I know," the other sighed. "He kicked Sarah out over one because she handed him a hemostat too slowly. Now he needs a scrub nurse for the VIP case." Aisha stayed frozen. "Please don't see me." "Hey, Reynolds." The charge nurse, a tough woman named Maggie, poked her head around the lockers. Aisha looked up. "Yes, Maggie?" "You're up," Maggie said, checking her clipboard. "Brock fired Sarah. I need you in or one. You're scrubbing in for the senator's daughter." Aisha's blood ran cold. "Me," she stammered. "But Dr. Brock just yelled at me in the hallway. He doesn't like me." "He doesn't like anyone," Maggie shrugged. "But you're the only one fast enough to keep up with him. And you're quiet. He likes quiet." Maggie leaned against the locker. "Just do what he says, pass him the tools, and for the love of God, don't speak unless he asks you a question. We need this surgery to go perfectly. The donor money for the new wing depends on it." Aisha stood up. She felt the weight of the invisible journal beneath her clothes. She was going into the lion's den. She was going to hand instruments to the man who had treated her like a servant. "I'll be ready," Aisha said. She walked to the sink to scrub in. She looked at her hands. They were trembling slightly. "Steady," she told herself. "It's just a repair. He knows what he's doing." But as she washed her hands, watching the soap swirl down the drain, she had a sinking feeling. She remembered the article she had just corrected. She remembered the helical curvature of the artery. And she wondered with a sudden, sharp fear, does Dr. Brock read the footnotes? Have you ever had to hide your intelligence just to fit in or keep a job? Tell me about it in the comments below. I read every story. Operating room 1 was a spaceship. The walls were lined with screens, the air was pressurized, and the lighting was so bright it cast no shadows. In the center of the room, under a mountain of blue sterile drapes, lay 10-year-old Lily. Her chest was cracked open, held apart by a retractor that looked like a medieval torture device. Her heart, a small muscle the size of a plum, was beating rapidly, exposed to the air. Dr. Gregory Brock stood over her, swaying slightly to the music. He insisted on playing Mozart's Requiem at high volume during complex cases. He claimed it helped his rhythm. The staff suspected it was just to drown out any questions. "Scalpel," Brock commanded, extending his hand without looking. Aisha slapped the handle into his palm. A perfect, firm pass. She was standing on a step stool to get the proper leverage. Her eyes were the only part of her visible above the mask, and they were locked on the surgical field. "Beautiful," Brock announced, speaking into the headset microphone that broadcast his voice to the observation gallery above. "As you can see, the atrial defect is standard. I'm going to use a patch repair. I'll be done in 20 minutes. Record time." He moved fast. Too fast. He was dissecting the tissue around the aorta with a confidence that bordered on recklessness. He wasn't looking at the tissue texture. He was looking at the camera overhead, performing for the board members watching from the glass box upstairs. "Forceps," Brock snapped. Aisha handed them over. As she did, her gaze flicked to the transesophageal echocardiogram monitor on the anesthesia cart. It was a chaotic mess of grayscale waves representing the blood flow. Most people saw static. Aisha saw a map, and she saw a glitch. It was a tiny flutter on the bottom of the wave, a phantom wave that appeared just after the systolic peak. Blip. It happened again. Blip. Aisha's breath hitched. That wasn't an artifact. That was a pressure echo. It meant there was a secondary structure behind the aorta, a hidden vessel, or a thinning of the wall that the scans hadn't picked up. If Brock clamped down where he was planning to clamp, he wouldn't just stop the blood flow. He would tear the hidden vessel. The child would bleed out in seconds. She looked at Brock. He was raising the cross clamp, aiming for the aorta. "Doctor," the anesthesiologist said, looking bored. "Pressure is stable." "Excellent," Brock smiled beneath his mask. Applying the cross clamp now. He moved the heavy metal clamp toward the beating heart. Aisha couldn't stop herself. The surgeon in her brain overrode the nurse in her body. "Wait," Aisha whispered. It was quiet, but in the acoustic bubble of the oar, it was audible. Brock froze. The clamp hovered an inch from the artery. He didn't look up. He just stopped moving, his shoulders stiffening. "Did someone speak?" Brock asked, his voice icy. The room went dead silent. The Mozart seemed to get louder. Aisha felt the eyes of the entire team on her. The scrub tech next to her nudged her foot. "Shut up." But Aisha looked at the monitor. The blip was still there. Blip. Blip. "Doctor," Aisha said, her voice trembling but clearer this time. The monitor. "Look at the return wave. There is a phantom echo behind the aortic root." Brock slowly turned his head. He looked at her with an expression of profound, incredulous irritation. "A phantom echo?" Brock repeated, mocking her accent. "You're reading the TE now? I didn't know they taught cardiology in wherever you received your nursing certificate." "I am just saying," Aisha persisted, her hands shaking inside her sterile gloves. "The arterial wall looks thin. There might be an anomaly. If you clamp there, it could rupture." "It looks thin," Brock scoffed. "To you. From over there." He looked up at the gallery. He knew the board was watching. He couldn't let a scrub nurse question his judgment in front of the donors. "This," Brock pointed the clamp at the heart, "is a standard anatomy. I have done 1,000 of these. I do not need a lecture on structural anomalies from the person who hands me the sponges." "But sir—" "Quiet," Brock barked. The shout echoed off the tile walls. "You are here to pass instruments, not opinions," Brock hissed, leaning over the patient, his eyes drilling into hers. "You are here to be invisible. If I hear one more word from you that isn't yes, doctor, I will have you removed and banned from this hospital. Do you understand?" Aisha felt the heat rise in her cheeks. The humiliation was physical. It felt like a slap. She looked at the monitor. The danger was still there. She looked at the child's beating heart. She looked at Brock's ego. She lowered her eyes. "Yes, doctor," she whispered. "Good," Brock grunted. "Now give me some suction. I'm going in." He turned back to the patient. He squeezed the handle of the clamp. Aisha watched the metal jaws close around the aorta. She held her breath, praying she was wrong. Praying that for once, her eyes had deceived her. But she knew she wasn't wrong. She knew exactly what sound was coming next. Aisha stepped back. It was a physical retreat, a shrinking of her presence until she was just a pair of eyes and a pair of hands in the periphery of Dr. Brock's vision. Her heart was hammering a frantic rhythm against her ribs, out of sync with the steady beep-beep-beep of the patient's monitor. She wanted to scream. She wanted to reach across the sterile field and grab Brock's wrist. She wanted to tell him about the helix curvature, about the way the retroesophageal artery hid behind the aorta like a snake in the grass, invisible until it was too late. But she didn't. She looked at Maggie, the circulating nurse standing by the computer console. Maggie's eyes were wide above her mask. She gave a microscopic shake of her head. "Don't," Maggie's eyes said. "He will destroy you. You have a sister to feed. You have rent to pay. Let him be the doctor." The hierarchy of the operating room was invisible, but it was heavier than lead. It crushed the air out of the room. It said that a mistake by a chief surgeon was a tragedy, but a correction by a nurse was mutiny. Aisha swallowed the bile in her throat. She gripped the suction hose. She forced her muscles to relax, forced her breathing to slow. Suction, Brock commanded, not looking at her. Aisha moved the tip of the suction wand into the cavity. She cleared the small amount of blood pooling around the clamp. Clamp is on, the anesthesiologist announced. Flow is stopped. Pressure is holding. Brock let out a breath. He looked up at the gallery, flashing a triumphant look at the board members behind the glass. You see? Brock said, his voice booming over the speaker system. The anatomy is textbook. Sometimes lesser experienced staff can get spooked by shadows on the monitor. It takes a trained eye to know the difference between a threat and a glitch. He looked down at Aisha. His eyes crinkled at the corners, a smile hidden by a mask but no less smug. No issues, Brock said to her, his voice dripping with condescension. The wall is solid. The clamp held. This is why I am the surgeon, and you are the help. Do you see now? Aisha looked at the clamp. It was biting deep into the tissue. The tissue looked pale, strained. To Brock, it looked secure. To Aisha, it looked like a dam about to burst. Yes, doctor, she lied. I see. Good, Brock chuckled. Maybe stick to reading romance novels in the break room, Leave the diagnostics to the adults. The insult was cheap, but it did its job. It put her back in her box. Metzenbaum scissors, Brock ordered. Aisha grabbed the long, curved scissors from the tray. She slapped them into his hand. Brock twirled the instrument in his fingers, a showy, arrogant move. Proceeding with the incision, Brock announced to the room. I'm going to open the aorta and patch the defect. Clock starts now. He lowered the scissors. The room held its breath. The only sound was the thrum of the bypass machine and the classical music that Brock had turned up even louder. He placed the tip of the scissors against the artery. He made the cut. Snip. The tissue parted cleanly. Exposure is perfect, Brock murmured. Look at that. Clean edges. No bleeding. He glanced at Aisha again, gloating. See, he taunted. You were terrified of nothing. The vessel is clear. I told you. I could do this with my eyes closed. He widened the cut. He reached in with forceps. Aisha watched the monitor. The phantom wave was gone because the flow was clamped. But the physics hadn't changed. The tension on the back wall of the artery, the wall he couldn't see, the wall she knew was fused to a hidden vessel, was increasing with every millimeter he pulled. Please, she prayed silently. Please let me be wrong. Let him be the genius he thinks he is. Brock hummed along to the music. He was enjoying himself now. The fear was gone, replaced by the high of performance. He felt invincible. He felt like a god in a blue gown. Just a little more traction, Brock muttered. He pulled the tissue harder. Aisha saw it before he did. She saw the tiny, dark bloom of red appear at the bottom of the incision. It wasn't the bright red of oxygenated blood. It was dark, venous, or worse, arterial blood from a high-pressure source that had been held back by a thin membrane. Doctor, Aisha started, her voice a whisper. Silence, Brock snapped. I am working. He pulled again, and then the world turned red. It didn't happen like in the movies. There was no slow-motion fountain. There was a sound, a wet, tearing pop, and then the chest cavity simply disappeared. 1 second, there was anatomy, muscle, rib, aorta. The next second, there was only red. Dark, venous blood welled up from beneath the aorta with terrifying speed. It didn't spray, it flooded. It filled the pericardial sac in a heartbeat, overflowing the retractors, spilling onto the sterile drapes and dripping onto the floor. Splash. Splash. Suction. Brock screamed. The calm, arrogant baritone was gone. His voice was a shriek. I can't see. Brock yelled. Where is it coming from? Suction. More suction. Aisha jammed the suction wand deep into the pool of red. The machine made a horrible, gurgling, choking sound as it tried to drink the ocean. But for every ounce she removed, the heart pumped out 2 more. WOWO. The monitors exploded into noise. The rhythm vanished, replaced by the erratic, jagged lines of hemodynamic collapse. Pressure is dropping, the anesthesiologist shouted, his boredom replaced by terror. 60/40. She's crashing. I'm pushing AP. Don't tell me what you're pushing. Fix the pressure. Brock roared. He plunged his hands into the chest. He was flying blind. He started snapping hemostats blindly into the red pool, trying to clamp anything he could feel. Click, click, click. He was clamping air. He was clamping muscle. He was clamping nerves. Doctor, stop! Aisha cried out, seeing his hands shaking uncontrollably. "You're tearing the tissue. You're making it wider." "Shut up." Brock slammed his shoulder into hers, nearly knocking her off her step stool. The physical contact was violent, desperate. "It's the pump. The pump is too high. Turn it down." He looked up at the gallery. The board members were standing, pressing their faces against the glass. They were watching their golden boy drown in blood. The shame hit Brock harder than the panic. He couldn't fix this. He didn't know what he had cut. The anatomy didn't make sense. It wasn't in the textbooks. He looked at his hands. They were covered in crimson up to the elbows. They felt heavy, useless. I can't see the bleeder," Brock whispered, the realization crushing him. The room was a sealed box of chaos. The air scrubbers hummed loudly, trying to cycle the metallic scent of copper out of the room, but it was too strong. It coated the back of Aisha's throat. She watched the monitor. The line was flattening. 50/30. The child was dying. Right here. Under the hands of the man who had bragged about his mortality rate 10 minutes ago. Brock stopped trying. He pulled his hands out of the chest, holding them up in a gesture of surrender. He stepped back, hyperventilating. "It's a rupture," Brock stammered, looking at the anesthesiologist, looking for a scapegoat. The vessel wall, it disintegrated. It was faulty tissue. No one could have predicted this. He was writing the autopsy report before the patient was even dead. He was saving his career, not the girl. Aisha looked at the open chest. She looked at the blood pooling, dark and hot. She was trapped in the red zone. That terrifying intimacy of a surgical disaster where hierarchy dissolves and only survival remains. She looked at Brock. He wasn't a god anymore. He was a scared old man in a dirty gown. She looked at the suction wand in her hand. Flash. The lights of the ore flickered in her mind. The smell of expensive espresso vanished, replaced by the smell of diesel fumes and humid rain. She wasn't in America anymore. She was back in Lagos. The frantic beep 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 of the monitor began to distort. To Aisha, it slowed down, warping into a heavy rhythmic thug thug thug. The bright white lights of the operating room flickered and died in her mind. Time shift, 4 years ago. Lagos, Nigeria. The air was heavy, thick with humidity and the smell of unwashed bodies and iodine. Aisha stood in Trauma Bay 4 of the Lagos University Teaching Hospital. It was 3 a.m. during the rainy season. The power grid had failed hours ago. The backup generator was sputtering, coughing out black smoke that drifted through the open windows. On the table in front of her lay a young man, a victim of a roadside accident. His chest was open. "Dr. Reynolds!" A nurse shouted over the roar of the rain on the tin roof. "We're losing the light. The generator is dying." The overhead lamp dimmed to a dull orange glow, then blacked out completely. Pitch darkness swallowed the room. "Flashlights," Aisha commanded. Her voice wasn't soft then. It was iron. "Get the phones. Anything." 3 nurses scrambled, turning on cell phone lights and holding them over the open chest cavity. The beams cut through the gloom, shaky and weak, illuminating the blood in erratic flashes. "I can't see the bleeder," the assisting resident panicked. "There's too much blood. We have to clamp the aorta." "No," Aisha said. She closed her eyes. In the flickering light, vision was a liability. It played tricks. Shadows looked like veins. Veins looked like nerves. She plunged her hands into the warm blood. She didn't look. She felt. She traced the anatomy with her fingertips. She felt the strong, thumping pulse of the aorta. She slid her finger behind it, exploring the hidden space against the spine, the retroesophageal void. There. She felt it. A jagged tear in a vessel that shouldn't be there. A helical artery, twisted around the esophagus like a vine. It was a rare mutation, common in specific West African genetic lines, but almost unknown in Western textbooks. "It's a helical tear," Aisha announced in the dark. "If I clamp it, I crush the vocal nerve. I have to stitch it open." "You can't stitch what you can't see," the resident cried. "I can see it with my hands," Aisha whispered. She held out her hand. 4-0 proline. Small needle. In the erratic strobe light of the cell phones, Aisha performed the impossible. She visualized the geometry of the tear in her mind. She used her left index finger to plug the hole, feeling the flow of blood against her skin. She used her right hand to drive the needle. Dip. Turn. Pull. She tied the knot by feel, the suture sliding against her gloves. Dip. Turn. Pull. She did it 3 times. The blind stitch. a technique born of necessity, forged in the dark when technology failed and only humanity remained. She pulled the final knot tight. "Release the pressure," Aisha ordered. She removed her finger. The blood stopped flowing. The chest cavity cleared. The heart beat on, strong and rhythmic in the dark. "He's stable," the resident breathed, shining his light on the perfect row of sutures. "Doctor, that was magic." "It wasn't magic," Aisha said, stripping off her bloody gloves as the generator finally kicked back on, flooding the room with light. "It was anatomy." Snap. The sterile, freezing air of the American rushed back into her lungs. Aisha blinked. The terrified face of the resident in Lagos was replaced by the terrified face of Dr. Brock. The blood was the same. The panic was the same. And the injury was the same. She looked at the pool of blood in the child's chest. Brock was still babbling about faulty tissue, about a rupture, about things he couldn't control. He was looking for something to see. But the problem was hidden. Aisha looked at her hands. They were trembling, but not from fear anymore. They were trembling with muscle memory. They remembered the curve. They remembered the knot. She knew exactly what was bleeding. She knew exactly where it was hiding. And she realized, with a clarity that cut through the noise of the alarms, that Dr. Gregory Brock, the man with the plaque on the wall and the perfect mortality rate, had absolutely no idea what to do. He was a pilot who only knew how to fly in clear skies. She was a pilot who had learned to fly in a storm. Aisha took a step forward. She didn't ask for permission. She didn't look at the board members. She reached out and grabbed the suction wand from Brock's frozen hand. Dr. Gregory Brock stared into the open chest cavity. To him, it looked like a Rorschach test made of red ink. He couldn't distinguish the aorta from the pool of blood rising around it. His brain, usually a catalog of procedures and protocols, was blank. He looked at the monitor. 40/20ths. The numbers were blinking red. The pitch of the alarm had changed to a continuous, high-frequency whine that signaled imminent cardiac arrest. Brock's hands fell to his sides. They hung there limp, dripping crimson onto his expensive surgical shoes. "Aye!" Brock choked. His voice was so quiet the gallery couldn't hear it, but Aisha could. "I can't see the source. It's gone. She's gone." He stepped back. It was a microscopic movement, but it was a resignation. He was giving up. He was preparing his concession speech for the parents. The circulating nurse covered her mouth. The anesthesiologist stopped pushing drugs, his hand hovering over the time of death log. The room died. Then Aisha moved. She didn't step back. She stepped forward. She stepped into the space Brock had vacated, the surgeon's box. She grabbed the suction wand from the sterile field. "Suction to max," Aisha ordered. Her voice wasn't the soft, accented whisper of the immigrant nurse. It was the command voice of a trauma chief. The circulating nurse blinked, stunned, but obeyed instinctively. She cranked the dial. Thuck. The suction roared. Aisha didn't wave the wand aimlessly. She drove it deep, past the aorta, pushing against the spine. She used the tip like a probe, sweeping the fluid away with aggressive, calculated strokes. She wasn't looking for a rupture in the aorta. She was looking behind it. "There," Aisha said. She held the suction steady with her left hand. With her gloved right index finger, she pointed into the cavity. "Do you see the pulse?" Aisha asked, looking at Brock. "Behind the aortic root. For a clock position." Brock blinked, shaking himself out of his stupor. He leaned in, squinting. As the suction cleared the field for a split second, he saw it. A tiny, rhythmic fountain of blood spurting from a vessel that shouldn't have been there. "What is that?" Brock whispered. That's not in the anatomy books. "It is a retroesophageal helical artery," Aisha stated flatly. "It is rare, but it happens in 12% of specific genetic phenotypes. You nicked the apex of the curve when you pulled the aorta." She looked up. Her eyes locked with his over-the-blue masks. For the first time, Brock didn't see a scrub nurse. He didn't see a janitor. He saw a peer. He saw someone who knew something he didn't. The arrogance drained out of him, leaving a terrifying void. He realized he was standing on the edge of a cliff, and this woman, the woman he had humiliated, the woman whose name he didn't even know, was the only one holding a rope. "Aye," Brock stammered. "I've never seen a helical tear. I don't know how to clamp it without crushing the vagus nerve." The monitor whined. 30/15. "You have 30 seconds before brain death," Aisha said calmly. Brock looked at his hands. They were shaking violently. He couldn't hold a needle. He couldn't tie a knot. He was paralyzed by the weight of his own failure. He looked at Aisha. His eyes were wide, wet with panic. The god complex was gone. There was just a man begging to be saved. "I can't do it," Brock whispered, his voice cracking. "My hands. I can't." He shoved the needle driver toward her. "Show me," he begged. "Please. Show me what to do." It was a surrender. It was a violation of every protocol in the hospital. A chief surgeon handing his instruments to a nurse in the middle of a VIP surgery. Aisha looked at the needle driver. She knew the risks. If she took it, she was practicing medicine without a license. She would be deported. She would be arrested. She looked at the child's heart. It was fluttering, fighting to beat against the lack of volume. Aisha grabbed the instrument. "Get out of my way," she said. Brock took the needle driver. His hands were vibrating. It wasn't a tremor. It was a seizure of the nerves. He tried to lock the needle into the jaws of the instrument, but the metal clicked and slipped. Clink, clink. He couldn't engage the locking mechanism. "Steady," Brock whispered to himself, sweat stinging his eyes. "Just steady." He moved his hand toward the open chest. But his depth perception was gone. The adrenaline had blown out his fine motor skills. He looked at the tiny, spurting artery deep in the dark hole of the chest. It looked miles away. He lunged with the needle. "No!" Aisha hissed. He missed. The needle tore through healthy tissue next to the bleed, creating a new laceration. Blood surged higher. The monitor stopped beeping. Hey. The sound was a flat, monotone scream. It filled the room, drilling into everyone's skull. The red line on the screen went horizontal. Asystole. The child's heart stopped. "She's flatlined," the anesthesiologist said, his voice flat, professional, and resigned. He looked at the clock on the wall. "Time of death." "Stop!" Brock dropped the needle driver. It fell into the bloody cavity. He stepped back, ripping his mask off, gasping for air. "I called it. I said it was a rupture. It was inevitable." He looked up at the gallery. He threw his hands up, performing his defense for the board. "You all saw it." Brock shouted at the glass. "The tissue failed. There was nothing I could do." He was giving up. He was letting a 10-year-old girl die to save his insurance premium. Aisha looked at the monitor. The line was flat, but she knew something Brock didn't. She knew the heart wasn't dead. It was empty. It had nothing to pump. If she closed the hole now in the next 10 seconds, and they pushed volume, it would restart. "She is not dead," Aisha's mind screamed. "She is waiting." Aisha looked at Brock. He was standing between her and the patient, blocking the field, babbling excuses. Something inside Aisha snapped. It was the tether that bound her to the role of nurse. It was the fear of deportation. It was the training that told her to be invisible. It all broke under the weight of the flatline tone. "Move," Aisha said. Brock didn't hear her. He was still shouting at the ceiling. Aisha didn't ask again. She planted her feet. She lowered her shoulder. She slammed her body into the chief of surgery with the force of a linebacker. Wham! "Get out of the way!" Aisha screamed. Brock stumbled back, shocked, tripping over the suction tubing. He hit the wall with a heavy thud. The room gasped. It was a sound of pure horror. A nurse had just physically assaulted the chief of surgery. It was a fireable offense. It was assault. It was insanity. Aisha didn't care. She reached into the chest cavity. She didn't care about sterility anymore. She fished out the needle driver Brock had dropped. She grabbed a fresh needle from the tray. She stepped up to the table. "You can't touch her," Brock yelled, scrambling to his feet. "Security. Get her out. She's crazy." Up in the gallery, the chairman of the board pressed the emergency intercom button. "What is going on down there?" The chairman's voice boomed into the room. "Nurse, step away from the patient." Aisha didn't look up. She didn't look at Brock. She locked the needle into the driver. Click, click. She closed her eyes for a split second, visualizing the helical tear. She wasn't a nurse. She wasn't a janitor. She was a surgeon. She plunged her hands into the blood. Thud, thud, thud. Security guards were slamming their fists against the reinforced glass of the gallery. "Open the door," a voice boomed over the intercom. "Police are en route. Step away from the patient." Aisha didn't hear them. The noise of the world, the screaming board members, the sobbing circulating nurse, the alarms, faded into a dull roar like the ocean heard from underwater. She was alone in the chest cavity. She inserted her left index finger into the pool of blood. It was warm, slick, and opaque. She couldn't see the needle. She couldn't see the artery. She had to trust the map she had drawn in her mind 4 years ago in a dark room in Lagos. She felt the spine. She moved anteriorly. She felt the heavy, limp tube of the aorta. There. Her fingertip brushed against the ragged edge of the helical tear. It was pulsing faintly, a ghost pulse from the residual pressure. "Restarting CPR," the anesthesiologist yelled, reaching for the defibrillator paddles. "No," Aisha barked, not looking up. "If you compress the chest, you'll tear the stitch. Give me 10 seconds. "You don't have 10 seconds, the anesthesiologist screamed. "She's dead." "She is not dead," Aisha whispered. "She is sleeping." She drove the needle. Dip. She felt the curve of the steel pass through the tough adventitia of the artery. She twisted her wrist. Turn. She felt the tip emerge on the other side of the tear. It was a movement of millimeters. If she went too deep, she would catch the esophagus. If she went too shallow, the stitch would rip out when the pressure returned. She pulled the thread. 1. She threw the knot. She did it entirely by feel, her gloved fingers dancing in the blood. Alistair, no, Brock, was standing against the wall, sliding down to the floor. He watched her. His mouth was open. He recognized the movement. It wasn't the clumsy fumbling of a nurse. It was the elegant, efficient movement of a master surgeon. Dip. Turn. Pull. 2. Security is breaching the doors. Maggie shouted, looking at the scrub room entrance. They're scrubbing in. Aisha didn't flinch. She placed the final stitch. Dip. Turn. Pull. 3. She tightened the knot. She felt the tissue approximate, pulling together, closing the hole. She withdrew her hands. She looked at the anesthesiologist. Her mask was splattered with blood. Her eyes were hard and bright. "The hole is closed," Aisha said. "Push AP. Shock her." The anesthesiologist hesitated. He looked at the flatline. He looked at the insane nurse who had just hijacked his oar. Then he looked at the child. He grabbed the paddles. "Charging to 200, he said. "Clear." Aisha stepped back. Thump. The child's body arched off the table. They waited. The monitor was a solid green line. "Nothing," the anesthesiologist said. Again. "Charging to 300. Clear." Thump. Silence. Brock put his head in his hands. "It's over," he moaned. "We killed her." Aisha stared at the monitor. She gripped the edge of the instrument tray until her knuckles turned white. "Come on," she willed the heart. "I did my part. Do yours." The green line flickered. It jumped. A jagged, ugly spike. Then another. Then a rhythm. Beep. 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 "Sinus rhythm," the anesthesiologist gasped. "We have a pulse. Pressure is rising. 60/40. 80/50. He looked into the chest. The repair was holding. There was no fresh blood. "The bleeding has stopped," he whispered. The doors to the OR burst open. 3 security guards rushed in, weapons drawn, followed by the chairman of the board. "Hands in the air," the lead guard shouted at Aisha. "Step away from the table." Aisha raised her bloody, gloved hands. She stepped back, hitting the wall. She looked at the monitor. 90/60. The child was alive. She let out a long, shaky breath. "I surrender," Aisha said. The monitor beeped. Beep. It was a lonely sound in the crowded room. Beep. Then another. Stronger. Louder. The green line on the screen spiked, fell, and spiked again. A perfect, rhythmic sinus wave. 95/65. The child's heart, which had been silent 10 seconds ago, was beating. It was pumping blood through a closed system. The helical tear, the impossibility that had defeated the chief of surgery, was sealed tight. Aisha slumped against the wall. The adrenaline crashed out of her system, leaving her knees weak. She looked at her hands. They were covered in blood, shaking violently now that the work was done. She has a pulse," the anesthesiologist whispered, staring at the screen as if it were a religious apparition. The security guard lowered his hand. He looked at the board chairman, who was standing in the gallery window, pressing the intercom button. "Officer," the chairman's voice boomed, trembling with emotion. "Stand down. Do not touch her." The guard stepped back. In the operating room, no one moved. They were all looking at the chest cavity. Dr. Brock slowly walked back to the table. He moved like an old man. He looked into the incision. He had to see it. He had to understand what had just happened. He saw the aorta. And behind it, tucked into the shadow of the spine, he saw the 3 blue knots. They were spaced with mathematical perfection. The tension was exact. It was the work of a master. It was better than anything he could have done on his best day. Brock looked up. He looked at the janitor, who had cleaned his shoes that morning. "You," Brock croaked. "Who are you?" Aisha pulled down her mask. She didn't look down. She looked him in the eye. "I am Dr. Aisha Reynolds," she said, her voice quiet but firm. "Cardiothoracic Fellow of the University of Lagos. And I am the one who just saved your patient." Silence. Then a sound came from above. Clap. It was the chairman. He was clapping his hands against the glass. Clap. 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 The other board members joined in. Then the anesthesiologist. Then Maggie. The applause grew. It wasn't the polite applause of a golf tournament. It was the visceral, tearful applause of people who had just watched a miracle. It filled the sterile room, bouncing off the tiles, louder than the Mozart, louder than the alarms. Aisha stood in the center of it, stunned. She had expected handcuffs. She received an ovation. 2 hours later, the boardroom smelled of lemon water and expensive leather. The same smell as Act 1, but the temperature felt different. Warmer. Aisha sat at the head of the table. She was still wearing scrubs, though she had changed into clean ones. Her hair was down, framing a face that was no longer hidden. The chairman sat opposite her. "We reviewed the footage," the chairman said. "And we reviewed your credentials. It seems our HR department made a catastrophic oversight." He slid a piece of paper across the mahogany table. "Dr. Brock has tendered his resignation," the chairman said. "Effective immediately. He cited health reasons, but we all know the truth. He cannot lead a department where he is not the best surgeon in the room." Aisha looked at the paper. It wasn't a firing slip. It was a contract. Offer of employment position. Surgical resident, fast-track program. Department, cardiothoracic surgery. "We can't make you an attending immediately," the chairman apologized. "The medical board requires you to complete a U.S. residency. But we can fast-track you. 2 years. Full salary. And you run the anomalous arteries unit." He leaned forward. "We need those hands, doctor. St. Jude's needs them." Aisha touched the paper. It felt real. It felt like the end of a long, dark tunnel. "And my sister?" Aisha asked. "I need to bring her here." "Done," the chairman said. "Visa sponsorship is included." Aisha smiled. It was the first time she had smiled in America. She walked out of the hospital as the sun was setting. The sky was a brilliant streak of purple and gold. She stopped at the bus stop. She looked at her reflection in the glass of the shelter. She didn't see a scrub nurse. She didn't see a ghost. She saw a surgeon. A young intern ran out of the hospital doors, spotting her. "Dr. Reynolds," he called out. "Dr. Reynolds, wait. We have a question about the post-op orders for the senator's daughter." Aisha turned. The title sounded strange, new, and yet perfectly familiar. "I'm coming," she said. She turned around and walked back through the automatic doors, not to clean the floors, but to lead the rounds. Have you ever had a moment where your true talent finally shined through? Or have you witnessed someone else save the day when no one expected it? Tell me your story in the comments below, and don't forget to subscribe for more stories of hidden genius.